Today, we're diving into the top Medicare changes for 2026 that can impact your wallet and your health benefits. Whether you're on Original Medicare or a Medicare Advantage plan, understanding these updates is critical for both your budgeting purposes and planning your medical needs. Stick around until the end of the video for a bonus tip on how to stay ahead of these changes. Let's go ahead and jump right in and get started. First up, Medicare Part B premiums. The standard Medicare Part premium rate monthly in 2025 is $185. This is going to go up in 2026, unfortunately. For 2026, the standard rate for Medicare Part B premium is going to be about $206, which is roughly a 12% increase in premiums. This premium, deducted from your Social Security check or paid quarterly, covers your outpatient services and your doctor's office visits and more. Now, 12% sounds high, but in reality, it's only $31 of an increase for the entire year for all applicable medical expenses. Next up, the Part B deductible is also rising. In 2025, it was $257, covering things like doctor's office visits and lab tests. In 2026, the Part B deductible is jumping up to $288. That's a 12% increase. 12% sounds like a lot, but the reality is it's only $31 in total increase for the entire year. So not really the end of the world. If you're on Original Medicare with a supplement, say the most popular plan, G supplement, or possibly the N, you'll need to pay this deductible before the insurance carrier kicks in and starts helping you with the bill. So things like doctor's office visits, outpatient surgery, lab, they all apply to this plan deductible. For Medicare Advantage plans, many plans waive this deductible so you don't have to pay it, so it's less of a concern. But it is something you should consider if you're considering a switch to Original Medicare off of a current Medicare Advantage plan. Moving on to Part D, which covers prescription drugs. The maximum out-of-pocket limit for prescription drugs in 2025 is $2,000, while in 2026, that number is increasing to $2,100, which will be your total risk on prescriptions. That's a 5% hike. Once you hit this $2,100 limit, your medications are covered at no charge for the rest of the year. This is called the catastrophic phase. You might see that sometimes in the materials. But here's the catch. The $2,500 stop loss or cap limit only applies to drugs which are listed on your plan's drug formulary list of covered medications. If your meds aren't covered, then you're on the hook for the full cost. This $2,100 stop loss is part of the Inflation Reduction Act, which is designed to cap or curb your out-of-pocket costs. The prior stop loss limit was $8,000, so significantly higher, but we are seeing very large increases in premiums, therefore, as the carrier has to spend more money to cover the medications for you. Part D deductible increases. The Part D deductible is also increasing in 2026. In 2025, the maximum deductible for a Part D prescription plan was $590. For 2026, it's rising to $615 as the maximum deductible size, which is about a 5% increase. If you're on a high deductible Part D prescription plan, this means you're going to have to spend a little bit more out of pocket before the Part D prescription plan starts helping with either brand name or higher tier medications. If you're on generic medications, you might not feel this pinch since many generics have either zero or low copays, and the plans start helping you with that cost right away. Be sure to review your plan's annual notice of change to see how these changes affect you. Insulin and vaccine cost relief. Now for some good news. In 2026, insulin costs are being capped at $35 per month out of your pocket, and more insulin brands are being added to the drug formularies of covered medications. Plus, for vaccines, certain vaccines approved by Medicare will be reduced to zero copays or no charge out of pocket. This is a big win for those managing diabetes or wanting to stay up to date with your vaccinations like shingles or the pneumonia vaccine. These changes make Medicare healthcare much more affordable for many beneficiaries. Finally, an update on Medicare drug price negotiations and their M3P program. Finally, a game changer. For the first time, Medicare will negotiate drug prices and contracts with the drug manufacturers themselves in 2026. This applies to 10 high-cost drugs, including blood thinners like Eliquis and Xarelto, diabetes meds like Novolog and Jardiance, and other high-cost cancer medications. These savings might not show up immediately at the pharmacy, but should help to reduce your plan's overall costs. Plus, the Medicare Prescription Payment Plan, or M3P, lets you take your prescription costs and spread them out evenly throughout the year. For example, if your prescriptions max the drug plan out and you pay the $2,100 in annual prescription costs, the prescription plan allows you to separate the $2,100 payments into $175 monthly, making it easier to manage. This program is available to those who have either a Medicare Part D prescription plan or a Part D prescription plan bundled inside of a Medicare Advantage plan. Here's your bonus tip. Don't wait for these changes to surprise you. Check your annual notice of coverage letter sent in September for any changes affecting you directly. Open enrollment runs from October 15th to December 7th for 2026. So that's your window to make a decision and make plan changes for the upcoming years if you're on either a Medicare Advantage plan or a Medicare Part D prescription drug plan. If you're on a Medigap plan or supplement, then you can actually submit an application to change anytime, but medical underwriting may apply. And don't go it alone. Reach out to a licensed insurance agency like ours for free, unbiased assistance. That's it for the top Medicare changes for 2026. If you found this information helpful, click on the thumbs up button and please subscribe, and we'll keep you updated on Medicare news as it arises throughout the year. Got questions? Feel free to drop them in the comments. We will respond, or feel free to reach out to us directly and our team will help you for personalized care, unbiased and always free of charge. Check out our other videos for more Medicare tips, and we'll see you in the next one. Thanks for watching and take care.